Parkinson's disease. Understanding Parkinson's disease. Parkinson's disease, PD, is a condition affecting the central nervous system, leading to disturbances in body movements such as tremors, rigidity, slowed movements, unstable posture, and difficulty walking. The root cause of PD lies in the death of specific nerve cells, neurons, in the brain responsible for producing dopamine, a crucial chemical facilitating communication between brain regions that control movement. The demise of these neurons results in abnormally low dopamine levels, disrupting the regulation of muscle tension and movement. Risk factors and onset. The likelihood of developing PD is increased if a parent or sibling is diagnosed at a younger age, with no similar risk associated with older family members affected by the disease. Typically manifesting in middle age around 60, PD can occasionally begin earlier, with symptoms emerging before the age of 40. Early symptoms. PD often commences with subtle signs such as a slight tremor or stiffness, usually affecting one side of the body. The tremor is most noticeable when at rest, occurring rhythmically 3 to 6 times per second. Over time, tremors may become more widespread, impacting both sides of the body, and affecting activities like handwriting, which may become progressively illegible. As the disease advances, stiffness and bradykinesia, slowed movements, become more prominent, severely hindering the ability to walk and perform daily tasks like dressing, washing, or using utensils. Balance and posture issues make sitting and rising from chairs challenging, and walking is characterized by small, shuffling steps and a stooped posture. Facial muscles may also be affected, leading to reduced spontaneous facial expressions and normal eye blinking. Additional symptoms of PD may include depression, anxiety, disturbed sleep, memory loss, slurred speech, difficulty chewing or swallowing, constipation, impaired bladder control, abnormal body temperature regulation, sexual dysfunction, and muscle-related issues such as cramps, numbness, tingling, or pain. Risk signs of Parkinson's disease. Identifying the early signs and risk factors associated with Parkinson's disease, PD, is crucial for timely intervention and management. While these signs do not necessarily confirm Parkinson's, they may warrant further medical evaluation if observed. It's important to note that the presence of one or more of these signs does not guarantee the development of Parkinson's disease. Tremors. Description. Resting tremors, commonly referred to as pill-rolling tremors, usually begin in the fingers or hand on one side of the body. Observation. Tremors are often more noticeable at rest and may decrease or disappear during purposeful movement. Bradykinesia, slowness of movement. Description. Individuals may experience a gradual slowing down of movements, making routine tasks more time-consuming. Observation. Difficulty initiating or completing movements, particularly noticeable in activities such as buttoning a shirt or walking. Muscle rigidity. Description. Stiffness or resistance in the muscles, making it challenging for the affected individual to move. Observation. Rigidity can be evident during passive movement, where a healthcare provider may notice increased resistance when manipulating a limb. Postural instability. Description. Impaired balance and instability, increasing the risk of falls. Observation. Individuals may have difficulty maintaining an upright posture or may experience a stooped or hunched position. Changes in handwriting, micrographia. Description. Progressive reduction in the size of handwriting over time. Observation. Handwriting may appear cramped, small, and difficult to read. Shuffling walk and small steps. Description. A shuffling gait characterized by small steps and reduced arm swing. Observation. Difficulty in initiating and controlling steps, leading to a distinctive shuffling motion during walking. Masked facial expression. Description. Reduction in spontaneous facial expressions, often referred to as a masked face. Observation. Limited facial mobility, reduced blinking, and a lack of emotional expression. Sleep disturbances. Description. Changes in sleep patterns, including difficulty falling asleep or staying asleep. Observation. Restless sleep, frequent awakenings, or other sleep-related issues. Loss of sense of smell, hyposmia. Description. Gradual reduction in the ability to smell. Observation. Individuals may notice a decreased ability to detect or identify odors. Risk factors. Age. The risk of Parkinson's disease increases with age, with most cases diagnosed in individuals over 60. Family history. Having a close relative with Parkinson's may elevate the risk. Gender. Men are slightly more likely than women to develop Parkinson's. Diagnosis. The diagnosis of PD involves a thorough examination, with a focus on neurological assessments. Classic PD symptoms, including tremors, slowness of movement, rigidity, and gait problems, guide the diagnosis. While no specific diagnostic procedure or laboratory test exists, symptom improvement after taking PD medication often supports the accuracy of the diagnosis. Diagnosis of Parkinson's disease. Parkinson's disease, PD, is diagnosed through a comprehensive process that involves medical history assessments, a thorough physical examination, and, in some cases, additional tests. There is no single definitive test for Parkinson's, so the diagnosis is typically based on a combination of clinical observations and ruling out other potential causes for the symptoms. Medical history. Family history. The healthcare provider may inquire about a family history of Parkinson's disease, as a genetic predisposition can increase the likelihood of developing the condition. Onset and progression of symptoms. Detailed information about when the symptoms began, how they have progressed, and their impact on daily life is crucial for accurate diagnosis. Neurological examination. Classic symptoms. The doctor will assess for the cardinal symptoms of PD, including tremors, slowness of movement, bradykinesia, rigidity, and problems with balance and coordination. Response to medication. If there is a suspicion of Parkinson's, the healthcare provider might prescribe a short-term trial of Parkinson's medication to observe whether there is a positive response. The T-scan or imaging studies. The T-scan, while not always necessary, a DT scan, dopamine transporter scan, may be performed to assess dopamine levels in the brain. This imaging test can help differentiate between Parkinson's disease and other disorders with similar symptoms. Blood tests. Rule out other conditions. Blood tests may be conducted to rule out other medical conditions that could be causing the symptoms, such as thyroid disorders or vitamin deficiencies. Specialist consultation. Neurologist involvement. In many cases, individuals suspected of having Parkinson's are referred to a neurologist, a specialist in disorders of the nervous system, for a more detailed evaluation. Response to medication. Levodopa trial. The gold standard for diagnosing Parkinson's is often considered a positive response to levodopa medication. Improvement in symptoms after taking levodopa supports the likelihood of Parkinson's disease. Continuous monitoring. Follow-up assessments. As Parkinson's is a progressive disorder, continuous monitoring of symptoms and their response to treatment is crucial for ongoing management. Consideration of supportive evidence. Other non-motor symptoms. The presence of non-motor symptoms such as depression, sleep disturbances, or autonomic dysfunction may also contribute to the diagnostic process. Duration and prevention. Parkinson's disease is a chronic, often progressive condition with no known cure. Unfortunately, the exact cause of PD remains unclear, and preventive measures are not established. Treatment approaches. Although there is no cure for PD, various medications can manage its symptoms. Treatment initiation depends on the impact of symptoms on daily life and activities. Medications for PD either enhance dopamine levels in the brain or mimic dopamine effects. Levodopa, usually combined with carbidopa, is a commonly prescribed medication. While effective initially, long-term use may lead to side effects and complications, necessitating adjustments in dosage and frequency. Other medications, such as amantadine, anticholinergic drugs, monoamine oxidase B, MAO-B, inhibitors, and dopamine agonists, may be used alone or in combination with levodopa to address symptoms. Additionally, COMT inhibitors can extend dopamine's action in the brain when combined with levodopa. Depression, common in PD patients, may require treatment with antidepressant medications. Regular exercise and a balanced diet can contribute to an improved sense of well-being and body control. Surgical options, such as deep brain stimulation or precise destruction of targeted brain areas, are considered when medication responses are inadequate. Lifestyle modifications for Parkinson's disease. Exercise routines. Importance of regular exercise. Regular exercise plays a crucial role in managing Parkinson's symptoms by promoting flexibility, strength, and balance. It can also contribute to improved mood and overall well-being. Recommended exercises. Aerobic exercises. Engage in activities like walking, cycling, or swimming to enhance cardiovascular health and overall endurance. Strength training. Incorporate resistance exercises using weights or resistance bands to improve muscle strength. Balance exercises. Practice activities that challenge balance, such as standing on one leg or using stability balls. Flexibility exercises. Include stretching exercises to maintain and improve flexibility, reducing the risk of stiffness. Adaptations for safety. Always warm up before exercising and cool down afterward. Use support when needed, such as a chair or railing, to ensure safety during balance exercises. Modify exercises based on individual abilities, gradually increasing intensity over time. Nutritional guidance. Emphasizing a balanced diet. A well-balanced and nutrient-rich diet is essential for individuals with Parkinson's disease. It can support overall health and potentially alleviate some symptoms. Specific dietary recommendations. Antioxidant-rich foods include fruits and vegetables high in antioxidants, such as berries, spinach, and kale, to help combat oxidative stress. Lean proteins. Opt for lean protein sources like fish, poultry, beans, and tofu to support muscle health. Whole grains. Choose whole grains like brown rice, quinoa, and oats for sustained energy and fiber. Hydration. Stay adequately hydrated, as dehydration can affect medication effectiveness and exacerbate symptoms. Considerations for medication. Some medications may interact with certain foods, so consult with a healthcare professional about the timing of medication and meals. Maintain a consistent schedule for meals and medication to optimize absorption. Individualized nutrition plans. Work with a registered dietitian to create a personalized nutrition plan based on individual health needs and preferences. Monitor any changes in weight or nutritional status and adjust the diet accordingly. Supplements. Discuss the potential benefits of supplements such as vitamin D and omega-3 fatty acids with a healthcare provider. Therapies and rehabilitation for Parkinson's disease. Physical therapy. Improving motor skills and reducing stiffness. Physical therapy is a cornerstone in managing Parkinson's disease. Focusing on enhancing motor skills, reducing stiffness, and improving overall physical functioning. Key components of physical therapy. Customized exercise programs. Physical therapists design tailored exercise routines to target specific motor skill challenges and improve flexibility. Gait training. Work on walking patterns and posture to mitigate shuffling steps and stooped posture. Balance exercises. Implement exercises to enhance balance and coordination, reducing the risk of falls. Home exercise programs. Therapists often prescribe home exercise programs to reinforce gains achieved during in-person sessions. Regular adherence to these exercises is vital for ongoing improvement. Occupational therapy. Addressing daily challenges and maintaining independence. Occupational therapy is instrumental in helping individuals with Parkinson's disease navigate daily activities and maintain independence. Key components of occupational therapy. Adaptive strategies. Learn and implement techniques to simplify daily tasks, such as dressing, bathing, and cooking. Assistive devices. Explore and incorporate assistive devices to facilitate easier completion of activities. Environmental modifications. Make necessary adjustments to the home environment to enhance accessibility and safety. Cognitive training. Occupational therapists may engage in cognitive training to address any cognitive challenges associated with Parkinson's disease. Speech therapy. Addressing speech and communication challenges. Speech therapy is invaluable for individuals experiencing difficulties in speech and communication, including slurred speech. Key components of speech therapy. Articulation exercises. Practice exercises to improve clarity and precision in speech. Voice training. Work on vocal exercises to enhance voice projection and strength. Communication strategies. Develop strategies to overcome challenges in expressive and receptive communication. Swallowing evaluation and therapy. Speech therapists conduct assessments and provide interventions to address any swallowing difficulties that may arise. Group therapy. Participation in group therapy sessions can foster social interaction and provide a supportive environment for practicing communication skills. Collaborative approach. Therapies and rehabilitation work most effectively when integrated into a holistic care plan. Collaboration between physical therapists, occupational therapists, speech therapists, and other healthcare professionals ensures a comprehensive and tailored approach to addressing the unique challenges posed by Parkinson's disease. Frequently asked questions, FAQ, about Parkinson's disease. What is Parkinson's disease, PD? Parkinson's disease is a neurodegenerative disorder affecting movement. It occurs when certain nerve cells in the brain that produce dopamine die, leading to symptoms such as tremors, stiffness, and difficulty with balance and coordination. What are the early signs of Parkinson's disease? Early signs may include resting tremors, slowness of movement, bradykinesia, muscle rigidity, postural instability, changes in handwriting, shuffling walk, masked facial expression, sleep disturbances, and loss of sense of smell. How is Parkinson's disease diagnosed? Diagnosis involves a thorough medical history, neurological examination, and, in some cases, imaging studies. Response to Parkinson's medication, such as levodopa, can also be indicative. Are there risk factors for Parkinson's disease? Risk factors include age, most cases occur over 60, a family history of Parkinson's, and being male, men are slightly more susceptible. Can Parkinson's disease be cured? Currently, there is no cure for Parkinson's disease. However, various medications and therapies can help manage symptoms and improve quality of life. What is levodopa, and how does it help in Parkinson's treatment? Levodopa is a medication that gets converted to dopamine in the brain. It helps replenish the reduced dopamine levels, alleviating some of the motor symptoms associated with Parkinson's. What role does exercise play in managing Parkinson's symptoms? Regular exercise is crucial for managing Parkinson's symptoms. It can improve mobility, balance, and flexibility, and may also have positive effects on mood. Are there specific diets recommended for individuals with Parkinson's? While there is no specific diet for Parkinson's, a balanced and nutrient-rich diet is beneficial. Antioxidant-rich foods, lean proteins, and whole grains are often recommended. Can Parkinson's disease cause cognitive issues? Yes, some individuals with Parkinson's may experience cognitive issues over time. This can range from mild cognitive impairment to more severe conditions like dementia. What support is available for individuals with Parkinson's and their caregivers? Support groups, both in person and online, provide a platform for sharing experiences. Additionally, healthcare professionals, including neurologists and physical therapists, play a crucial role in providing guidance and support. Are there experimental treatments or clinical trials for Parkinson's? Yes, there are ongoing clinical trials exploring new treatments and interventions for Parkinson's disease. Patients may consider participating in these trials under the guidance of their healthcare provider. How does Parkinson's disease progress over time? Parkinson's is a progressive disorder, meaning symptoms typically worsen over time. However, the rate of progression varies among individuals, and early intervention and proper management can slow down the progression and improve quality of life. Your health matters. Quali.health